South Sudan has recently ended a long-standing civil war. Almost 50 years of fighting and chaos has nearly completely debilitated the healthcare system. Since the peace agreement of 2005, the South Sudan government's top priority has been and continues to be to rebuild the country's healthcare system and provide healthcare to the country's needy, especially women and children. Surveys from 2006 and 2010 report that a serious shortage of health services and qualified personnel to provide trained healthcare workers.
There are two main pillars for health, for any sound healthcare system: human resource and infrastructure. And these are almost, infrastructure in South Sudan is almost non-existent. People now talk of reconstruction, but even when you look back before 1983, you would find that there has not been much done in the area of infrastructure and health. Now, the human resource, the importance of it is, if you take maternal health as an example, to reduce maternal mortality, you must have a skill-based attendant. I said earlier we have few numbers in those. So we are concentrating at the moment on producing a skilled human resource. And in that regard, in our 5 training institutions, we are training midwives and nurses.
The mid-level cadres are the clinical officers, the nurses, the midwives, the technicians, like laboratory technicians.
According to a 2010 mapping survey, the healthcare staffing stands at 14,000, providing healthcare for a country with an estimated population of more than 8 million people.
Not even one midwife per 10,000 population. Similarly, when we talk of a nurse, WHO policy or regulation says 12.5 or 13 nurses per 10,000 population. It says 12.5 or 13 nurses per 10,000 population. The doctors should be at least 2 or 3 per 10,000 population. We have less than 1 doctor per 10,000 population.
Infant mortality is among the highest perhaps in the whole world. The available information tells us that 75 out of 1,000 livers, children in South Sudan, they died before they celebrate their first birthdays. They die because of malaria, they die because of pneumonia, they die because of the diarrheal disease and other infectious disease that could be prevented.
Malnutrition status levels in South Sudan are high, particularly among children under the age of 5. Children in 7 of the 10 states are likely to be underweight by the international health standards. Maternal mortality has been reported to be 2,054 per 10,000 live births. This is the highest level, not only in sub-Saharan countries, but in the world.
Maternal mortality and child mortality specifically are quite alarming. Maternal mortality stands at the rate of a ratio. It stands at 2,054 per 100,000 live births, and child mortality as well stands around 105 per 1,000 live births. This is comparably is one of the worst across the world. And if you look at the region, countries like Kenya, Uganda, you'll find them with the maternal mortality, although it is bad, it is still quite low compared to South Sudan. And so it becomes one of the major priorities of the Minister of Health to improve maternal and child health, reduce these alarming figures, and this can only be achieved through 2 main things. One, to improve the infrastructure and improve accessibility, and the third thing, which is actually one of the main pillars of health service delivery, is the human resource.
Malaria is an epidemic in over 95% of South Sudan. putting the whole population at risk, particularly with children under 5 years old and pregnant women.
%40 of our beds occupied in our hospital anywhere, they occupy because of malaria. That's why malaria has become very, very critical and very serious to deal with. We trying our best, but we still have so many challenges. One is the issue also of the human resource, like we talk about it, that can be managed and can effectively do the right treatment for the malaria in South Sudan. Lack of the necessary information with the mothers. Some of them, they don't know that it's critical to take their children to the nearest health facility in first 24 hours of the fever. So most of them, they come very late with the complications. Also, we don't lack a quality drugs assessment in South Sudan. Most of the drugs that is coming in is being given by non-professional people, and they give those drugs not based on the guideline that the National Minister of Health or the National Malaria Control adopt.
Health facilities in South Sudan are among the worst in the world. There are 71 hospitals in a country the size of East Africa, with only 3 teaching hospitals, 7 state hospitals, 514 health centers, and 5,000 community health clinics, the majority of which are non-functional.
Definitely less than 25% of the total population of South Sudan have access to the minimum basic health service, and this imposes a huge challenge for the leadership, for the government to be able, and the partners to be able to put in place and resources that will enable people who are involved in the health sector in South Sudan to be able to put in place basic infrastructure needed for the delivery of health.
As part of the 100 days program of the President, we have done the paperwork at the moment to construct about 100 health facilities over the next 3 years. If you don't have a reasonable infrastructure, even if you have equipment and skilled personnel, still you will not be able to deliver.
Challenges in healthcare are high and require enormous efforts to address the issues facing a country only 7 months old. Because of the war, providing healthcare in South Sudan is difficult despite the peace agreement signed in 2005.
When we started in 2006, the children that are fully vaccinated within international standards, they were at 2.7%. So we show the majority of our children, they don't fully vaccinated. But currently we are doing our very, very best to strengthen the API programs across all 10 states and the counties to ensure that the children have opportunity to be vaccinated. But nevertheless, the gaps are still too many to count. We lack human resources that are capable of coordinating and providing the necessary leadership at the state and the county, and mostly at the PM level. 14% of our population, of the people of Southern Sudan, have access to some sort of health facilities.
Access to primary health care and teaching clinics remains high. In the rainy season, it is impossible to travel by road. People must fly or travel by boat, but the majority of the people cannot afford the cost during the dry season. Many people are forced to walk and find the nearest clinic, which may be up to a 4-day walk, and those who cannot walk must be carried on a makeshift stretcher.
This should be a lesson for the leadership to be able to communicate with the rest of the world as a new nation. But equally, we need to put some resources in health. And so the government of South Sudan, the Republic of South Sudan, the leadership should increase the total budget allocation for health so that we are able to develop a minimum basic infrastructure needed for health. Equally, our partners need also to understand that without a basic infrastructure for health, we will not be able to develop and provide those basic services.
South Sudan is the size of East Africa with Burundi and Rwanda. The current health situation in the country is very challenging and made worse by budget constraints, limited infrastructure, lack of proper medical facilities, and human resources. There are strong needs to enhance service delivery for maternal and children's health care. Let us all join hands and build a health sector that provides quality care in South Sudan.